Hi, I'm Larry Macarenda, and welcome to Heart and Health Television. With us today, one of the doctors from Heart and Health, Dr. Michael Lee. Mike, great to have you here, and
Thank you.
we can inform some of our patients and the audience a little bit about Heart and Health and some of the doctors there. First of all, Mike, can you tell us a little bit about your background, or your medical
Sure.
schooling?
Well, I did my medical school in Stony Brook, so I've been in New York all my life, and then I did my residency in primary care internal medicine upstate in Rochester, New York, in Strong Memorial Hospital, and then after that I came back here, and I've been working pretty much since 1997, doing primary care. I do also urgent care as well, so. Um,
So you've seen it. You've seen quite a bit, as well as when they say emergency care and urgent care. Emergency rooms, broken bones, stuff like that.
right.
Now,
Seen a lot of stuff.
now the internal medicine part of it, I never quite understood that. What is that? Just like the intestines, stomach?
Well, internal medicine basically deals with adult patients primarily, although we do see some younger children as well at Heart and Health. But primarily we see mainly adults, in other words, in their teens or older. And we're dealing with the gamut of common complaints anything from like low back pain to sinus infections to dealing with hypertension, hyperlipidemia. So you name it, and we pretty much usually deal with it.
And we also do a lot of cardiac care because of Dr. Kavenstein, who's a cardiologist,
Right.
as well as diabetic care and follow-ups with that.
Exactly. So we have Dr. Kaverstein who comes to Heart and Health, and he does his cardiac workups for patients, and so we have a consultant there right there in the office, and we take care of their primary care needs and their acute problems. So we pretty much can do almost A to Z for the patients.
Now, the way things have been going in the health industry, I mean, and every day there seems like there's a new disease that's coming out or something else is coming down. We've had a crazy winter, so I know you're probably seeing a lot of shoulder pain, wrist pain, stuff like that from people shoveling. Hopefully, not any major heart attacks or anything like that.
That's true. We do see a lot of like back ailments. You pulled your back out after shoveling snow. We see falls. People that fell on the ice, slipped on the ice, banged their elbows, their knees, what have you. So,
What has being we're deep into flu season right now? What has been like one of the major things that you're seeing in the office?
well, I mean, we are definitely seeing more flu. I would say since January. So we're seeing more cases of flu. Of course, we see the upper respiratory infections, sinus infections, bronchitis as well. So, this is the time everybody gets sick, the crazy weather we're having here recently. So, hopefully it'll get better, but we deal with it.
What's some quick pointers that maybe we can give some of the people to avoid it? Now, we know that there's a lot of germ contacts with our hands, even using money, ATM machines, all these other things
Of
to
course.
maybe help, not pick up all these germs and bacteria.
Well, definitely, like you mentioned, good hand hygiene is good. So be washing your hands, frequently if you're touching money or handling other objects that other people may be handling. You don't want to be touching your eyes, your mouth frequently during the day. You should try not to do that because the things that you're touching are contaminated with bacteria or other parasites, and then you're touching your mouth, your eyes, and then lo and behold, you get an infection. And then it's really about keeping fit, exercising, eating right, getting enough sleep, all those things keep you healthy and away from the doctors.
And of course, one thing that you're always proactive about is a healthy diet.
Exactly. I'm a big believer in eating well and trying to exercise, and everybody needs more sleep, but if you do that and you follow with your doctors and you follow their recommendations, generally we won't have to see you too much.
Now, how often should people see their doctor? I mean, if they look at, well, I'm not sick, so I don't have to see the doctor. But we're finding out that you could really have something wrong with you, not have so many symptoms,
Right.
and then it could really strike you down later on.
Right. I mean, you definitely, I mean, obviously it depends on your age and your ailments and your chronic medical conditions. But in general, you should, definitely once you hit your 40s, you should definitely be getting a physical every every other year. Depending, as you get older, you need it every year. So, and of course, it depends on your chronic ailments. Diabetics, people that have heart disease, people that have other chronic ailments. They need to be followed up more closely. They may need to see their doctor every 3 months, every 2 months, depending on their medical problems.
Another thing that we're seeing a lot more of at Heart and Health, and I know some of the other medical doctors are seeing, is we're seeing quite a rise in arthritis, rheumatoid arthritis, and some of the other, I think it's the osteoarthritis.
Right, osteoarthritis. Well, we're seeing that especially because the population as a whole is aging, people are living longer. So, as you get older, your joints start to break down. There starts to be more inflammation. We have the problem with obesity in this country. So, all those things together combine to make it more likely that you're going to see problems with joints and arthritic problems.
Now, you've been working at Heart and Health for a while, and you have a very good rapport with a lot of your patients that come in to see you. Have you had, or have you gained more experience working at Heart and Health with some of these ailments?
Definitely, because Heart and Health, you see the gamut of patients. I mean, we deal with a lot of pain patients and knee problems, joint problems, like you mentioned, as well as the upper respiratory infections and back problems. So diabetics we're seeing a lot of. So you name it, we probably have seen it. So that's a good and bad thing.
Well, Dr. Lee, I want to thank you for spending this time out of your busy schedule here with us today and letting the public and our patients know a little bit more about Heart and Health and some of the doctors that work there. Thank you very much.
My pleasure. Take care.